This is the count, homeless count it's done, a point-in-time count in Mecklenburg County in January. This is what one would call squishy data. It's not exactly, you're not exactly sure about whether everyone gets counted or not. If you look at the school system and the kids that they claim are homeless, it's a much higher number than that. It's over 3,000 by themselves. So it's never quite clear about exactly how many of their homeless people there are. It's probably less clear as you get out into the suburban counties where I'm not certain that they make the same effort to count as goes on here. There's also a secondary thing that comes up in this, at least in the discussion. There's no evidence, no hard data to prove it, but that secondary thing is that homeless understand economic opportunity as well as anybody else. And so if you're going to be homeless somewhere in this region other than Mecklenburg County, maybe the first thing you want to do is figure out how to buy a bus ticket to get to Mecklenburg County, because here you have shelters, you have food, you have services that are available. So I don't know whether that happens, but if you talk to people in the business, they claim it does happen, and it makes sense. Here's another shocking prospect: foreclosures. Again, that's unheard of in the time that I've been here, where you have this many foreclosures in any year, and it's not stopping. 2011, if we had 2011, at least the first 5 months of 2011, it would be right there with the rest of those, 2.9, 2.10. They are spread across the region, but they are found specifically in some smaller areas. We have maps of those. I don't have them here, but it has been mapped. It brings up one of the things that is occurring demographically and will change how we treat need. And that thing that's being discussed some, I think it will be discussed much more during this decade and will show up in the census much more in 2010, is what is called the suburbanization of poverty. Poverty is moving out of the center city and the center city areas into the suburbs. If you look at these maps in Mecklenburg County, there is an arc of poverty that runs from 85 south, about in the vicinity of the airport, all the way around to 85 north and even beyond that. You look at that on a map for foreclosures, for various kinds of needs, and the colors just pop out. That didn't exist 15 years ago. That's also where this foreclosure activity is most prevalent, in starter homes that were built in the last few years. So this is also a drag on our regional economy, because one of the leading parts of our regional economy for years has been the construction business. Very few houses are being constructed. I think it was just this week that nationally the number of houses being built is lower than it's been since the Depression. That's reflected here. There are very few houses being built. Commercial real estate's in terrible shape. That's not getting built. So that part of the economy is a drag. And people say that the real estate business is not going to change until you get rid of this inventory that's stacked up. Okay, first thing we learned in regarding issues and concerns as we talked about housing is that there really isn't a shortage of housing units. There are more housing units in this county, in this region, and in this country than there are people who need to live in them. The supply is bigger than the demand. Then so what is the housing issue? They're the wrong kind of units. The need is rental, and that's increasing fairly significantly. What we have in stock are for sale. We need rental units that are organized in multifamily areas rather than just scattered housing. There's a severe shortage for people that are at the lowest income levels. For people living, for people having 0 to 30% of the average median income, which of course 0 is nothing, the homeless are up to 30%, it's not much more. There are very, very few options for them. There's a shortage of transitional housing, although we're beginning to see some here. Moore Place, McCreesh Place are a couple that we have seen here, but there's still a very large shortage of where you go when you can move from being homeless to at least somewhat independent living, or leaving incarceration. Where's that transition housing? Are you a first-time buyer or renter? What kind of housing services exist to help you understand how to do that? One of the things that we heard about quite frequently is that we needed to have people understand better about who lives in affordable housing, that it's the fireman, the policeman, the teacher, rather than the image that some people have of that. The lack of multifamily housing units in the surrounding suburban counties is severe. You just, in some areas you find some, but if you really want to see how little in any suburban county, go to Union County. There's almost none. And we were down there end of last week, and I asked, what would happen if somebody came in and requested a rezoning for 300 units multifamily out on the major street in the residential community. And they said that, everybody and his brother would show up to oppose that. One of the truisms is that if you propose multifamily housing, people don't want it. It's amazing how ironic that is, because almost all of us lived in multifamily housing. Everybody almost rented a place. I don't know what we did when we did that, but somehow nobody wants to allow renters in their community anymore. And of course, it's not rocket science, but it is something that needs to be said, is that people, no matter what their income level, want the same thing in a housing unit. They want it safe, they want it decent and not deteriorated or dilapidated. They want to have places that they can walk to. They want services available. In many cases, and people we're talking about here need transit. That's another one of those puzzling things that we'll have to deal with as we talk about that increased urbanization of poverty. How are you going to get transit from way out there into where the services are? This is the last one, health and mental health. Here the theme is prevention. It came up immediately once we started talking about this. Spend your money for prevention and not treatment. That doesn't mean treatment funding can go away because we haven't prevented these things in the past. But there certainly is an emphasis on doing that. Here's the percentage of adults in the region and in Mecklenburg County who are obese. We started out having obese and overweight on the same chart. That was so revolting that we quit doing that. That was about 65%. So now we're just doing obese, which is bad enough by itself. It's about 25%. That's based on body mass index, or BMI measurement. Here's an obesity figure for children 2 to 8. There are people who claim that that's too low, that they know it's better, higher than that from the people that they see. This is an indication of seniors with a self-care difficulty, and these are simple. These are like not being able to feed themselves all the time or not being able to dress themselves all the time. And if you stack enough of these up, then that means that these seniors have to leave where they are, their house. They no longer can age in place and have to go to an institution of some sort unless you can provide some care where they are, and then you can take care of some of those deficits. Healthcare, again, the top need or the top issue is preventive health services. We talked quite a bit about obesity and diabetes, particularly because obesity is clearly preventable, and if you have it, it's treatable.